So there is today's topic is assessment of goiter. Goiter is goiter is enlargement of thyroid gland. Goiter is called enlargement of thyroid gland. So whenever there is enlargement of thyroid gland, that is called goiter. अब हमने देखना ये होता है during the short case, once you perform your clinical examination, then we observe three things. One is the goiter. Number one is the goiter. If the swelling moves with deglutition, swelling is moving with a swelling reflex or deglutition, that is called goiter. Then we check function and structure of that gland. Function and structure. Okay? So we categorize it as function and structure, and we use the word goiter itself. Function, structure, and goiters, right? So आप इसको जो भी कह सकते हो, you can say like physiology and structure is anatomy. Physiology or anatomy, right? Function can be hyperthyroidism, or it can be normal. If it is hyperthyroid, we'll call it as toxic goiter. That will be called as toxic. This is your toxic. Remember, toxic is a clinical term. It is a clinical word. It is a clinical term for the function of thyroid. Okay, if say that this is toxic, that means patient is hyperthyroid. If we say normal, then we will label it as simple. No, not you. We just label it as simple. So we use two words, toxic or simple. And similarly, regarding structure, there are three possibilities. In one goiter, you may not feel any nodule. In one type of goiter, you may not feel any type of the nodule, right? So that will be called as diffuse goiter. Diffuse goiter, right? If you feel one nodule, that will be called as solitary nodule. Solitary nodule. And if you find out multiple nodules, then that will be called as multinodular goiter. I'm writing down MN, multinodular goiter. So all the terms go with goiter, goiter, goiter. Alright? So there are three possibilities, six possibilities then. अब आप लोगों ने बोलते जाना है साथ-साथ, ठीक है? There are six possibilities. One, it can be toxic, diffuse goiter. Toxic, solitary goiter. Okay. जब हम solitary का लफ्ज़ यूज करते हैं ना, whenever we use solitary, so we can just replace this word goiter as solitary nodule. Is this nodule stands for goiter itself. I will not label it as goiter. We'll just label it as nodule because it is simply a nodule over a normal goiter, right? तो इस पर आपने थोड़ा सा चेंज कर देना है. So let's go again. Toxic, diffuse goiter, toxic solitary nodule, toxic multinodular goiter, right? Again goiter, and simple diffuse goiter, simple solitary nodule, or simple multinodular goiter. So this is your diagnosis can be one of it. It's not differential diagnosis. Your diagnosis can be one of it in the short case. When during the short case your examiner says that what is your diagnosis, so then you are supposed to tell one of this possible diagnosis. And the task is very simple. Very simple. You will feel the patient. If you find out the signs of toxicity, you will label it as okay, this is toxic. If you find out the eye signs, you'll see the tachycardia, then you just simply label it as toxic. If you do not find any sign of toxicity, it's then simple. Like we all fall in the category of simple, right? If you do not find any nodules, then it will be called as diffuse. And if you find out single nodule, it will solitary nodule. And if you find out multiple nodule, multinodule. Right? So clear?
Yes.
And one possible diagnosis, another is 6 ke alawa. If the tongue protrusion test is positive, then it will be called as thyroglossal cyst. And last and the final may be carcinoma thyroid. Carcinoma thyroid. What are the findings in carcinoma thyroid?
Sir, there will be a firm swelling.
Firm swelling, firm to hard.
Firm to hard
swelling.
It may be adherent to the overlying
Adherent
skin.
to the skin.
And the lymph nodes are palpable.
And lymph nodes are palpable. 3 findings, and then you will just straightforward label that this is carcinoma thyroid. Then there is no need for this simple or diffuse or blah blah blah. Just carcinoma thyroid, either with signs of toxicity or not. Clear?
Yes.
और अगर आपके पास thyroglossal cyst है, then that is thyroglossal cyst. This is the diagnosis. Things are simple. You just have to open up your mind and clarify. So, thank you so much.